In our activities, we involve the survivors. We realize that survivors are so important. In fact, 2 of our organizations in the Ghana Breast Cancer Alliance, the Sister Support Network and the Reach for Recovery, were started by survivors. And we realize that when they tell their story, the women understand it most. We involve the opinion leaders and the chiefs who are in the area. In Ghana, we have every town or village has a chief, and the people respect them so much. So when you go to a place like that and you involve those traditional leaders, your message is well taken. The Queen Mothers are also very powerful, and the chiefs and the Queen Mothers are the people who rule every community in Ghana. We also involve the musicians. They also help us to pull the crowd. If you want to send a message along, those people help us to gather more women, because the more people listen to you, the more the message also goes out. We involve popular comedians to also entertain them. It brings people along, and it also helps us to remove the fear that surrounds breast cancer. People are still so scared of breast cancer in Ghana, and we think it's one of the ways to try and demystify the disease and to remove that fear. The ministers, district chief executives are also not left out. Lectures are given to organized women groups in the churches, various groups, and this is helping a lot. When I mention international collaboration, this is where we started. The Ghana Breast Cancer Alliance was started, to me, from this meeting, when we had the first international symposium in Ghana. That was in October 2008. And here we see all the people who made it start. We are so grateful for everybody. In Kumasi, we had the Ghana Breast Cancer Alliance meeting. And since then, we've been meeting on regular basis. This is part of the international collaboration. And I'm so grateful to everybody who made it possible, especially Suzanne Jean Coleman. Reach for Recovery, as I mentioned, and you realize that all the activities are similar. Sister Support Network, there are similar things that we do, going to the rural areas. So what we are doing these days is to map out the country so that we don't, duplicate each other's work. We don't want to go to a place where we will find Sister Support Network and Breast Care International at the same time. It wouldn't help anybody. So we map out the country, and we know that Sister Support is going to maybe the eastern region, Breast Care is going to the northern region, and by so doing, we'll cover the whole country. We see Dr. Bafwe, who is also involved in these activities. We realize that doctors have to be involved in the awareness creation exercises. Our people are such that when somebody who is not a medical person is talking about medical issues, they listen to it with some bit of skepticism. But when a nurse or a doctor or somebody who is in the medical field is talking about a medical problem, an international collaboration, you realize that it appeals to them more. There's one group which was formed as far back as 1999, but ran into problems, and we learned from that problem. The group didn't have any doctor among them or a medical person as such. So when they even went out and identified cases, the doctors in the teaching hospitals were not ready to accept the women. We have a bad referral system, bad in a way that even a house officer cannot refer a case to a consultant. How more do you expect somebody, a lay person, to refer a case to a consultant? So the women were identified with the problem, and the doctors were not ready to accept them. So it was a bit of a frustration, and that's how come we realized that all the advocacy groups in Ghana now have some other nurses, doctors, and the survivors, making it a whole group and carrying out the message to the people. We believe that with the concerted effort and through partnership and collaborations, more awareness will be created. And this triple tragedy of ignorance, illiteracy, and poverty can be conquered. Late presentation will be history, and overall and disease-free survival of our women will be much better than it has been. We are working towards this, and I hope everybody will help us to get there. Thank you very much.
Thank you very much, Dr. Wiafe. She has done a fabulous job of setting the stage for how we are going to be proceeding from here.